Hi everyone, and welcome back to another session on the MSRA professional. Hi everyone, and welcome back to another quick session on a question type from the MSRA professional dilemma section. So for those of you that haven't met me before, I'm Roshni and I'm a GP. I'm also very passionate about medical education and I run several SJT and clinical section question types for the ACE Medics team. So today, let's get straight into it. So let's have a look at today's question type. So we're going to get straight into it. So this is from the rating section of the paper. So I'm just going to give you guys a moment to just pause the screen and have a go at this question and just jot down your response. You can have around a minute or a minute and a half to just go through this question. Okay, fantastic. So let's go through, before we go through the answers for this question, what I want to do is to just again remind ourselves of the strategy of how are we actually approaching these questions, okay, because this is key. So in this question type, remember that you need to pick three options, okay, which together will be the most appropriate actions or the most important considerations or the most appropriate things to say. Okay, so the way that you need to go about this scenario is firstly, obviously, you read the scenario. Okay, you then read the statement options that you're given on the right. And what you want to do then is, because there are 8 options, to help with your speed, what you do is you use the process of elimination to rule out any options which are either negative or if they don't deal with the main issue. Okay, so what you will see is that each question type in the professional dilemma section, there is a main issue and there is something that you need to tackle. That main issue could be relating to professionalism, it could be relating to integrity, to confidentiality, to teamwork, to a struggling colleague. There is always something at the root of the issue, and you need to select the 3 options which together tackle that issue. So if you see that there are actually 2 options which are doing a similar thing, or they're pretty much the same, it is unlikely that both of these are correct. And by picking both of these, in turn, what it means is that you are likely not addressing another theme of the question, and you will therefore get one wrong. So if you are stuck and you are seeing 2 responses which they look like they're doing the same thing, or you're not sure which one is better, my advice would be to pay close attention to the language used and to compare similar responses, and that should guide you. Okay, and we will learn more about these techniques during our course. So when you have ruled out in the incorrect answers, okay, maybe you'll be left with just 4. Then what you want to do is you want to then just pick out the top 3 that you've selected and see, do these make sense together? Okay, now what I mean by this and why I'm emphasizing this is because you cannot pick 2 options which are contradictory to each other, or which mean that in doing one you can't do the other. So for example, if you're not sure about changing a drug dose, or if you're not sure about prescribing a drug, or you're not sure about a potential allergy relating to a drug, or you're not sure about doing something, you cannot pick the option which says prescribe the drug and the other option which says do not prescribe the drug. Okay, now that's a very basic example, or it can say keep the dose the same or change the dose. So these are quite obvious examples, but you will realize that when you do more questions, there are options which actually they are doing different things, but they're quite subtle. So you must pay attention to this, and obviously the more questions that we practice together, the more confident we will become. So as I explained, you need to make sure that each option that you are picking is addressing a different aspect of the scenario, and it is almost solving a different part of that problem. Okay, so let me just go back to our question now over here. So in this question, we'll just go through this now, and I've highlighted the correct options. So when you're working on a surgery rotation, your consultant has asked you to prescribe a high dose of warfarin for a patient to go home with. However, the pharmacist informs you that the hospital protocol advises to use a smaller dose of warfarin to begin with to reduce the risk of serious hemorrhage. Okay, so choose the 3 most appropriate actions to take in this situation. So this question is basically testing our ability to firstly practice safely and to work within your remit, and to ensure that patients are not being caused harm and that they are being given the appropriate medication. The second thing is about solving perhaps conflict or miscommunication, or working as a team and being able to appreciate different people's viewpoints and take a decision that is safe and the most effective. Okay, so obviously, if you're in this situation, you need to gather more information, don't you? Your consultant has said one thing, but the pharmacist has told you something else, and you, as a junior doctor, are not going to take the liability on of actually prescribing the wrong drug. Rather, you need to triangulate and get more information about this. Now, option A, so ask the pharmacist to supply the high dose of warfarin as per the prescription. So this is basically as good as doing nothing, and it is potentially causing harm. Now, clearly the question stem has told you that the pharmacist has given you some valid information. So pharmacists are a really reliable source, and they obviously have got a lot of specialist knowledge about specific prescriptions and in-depth knowledge on specialties as well. So if you're, for example, working on a surgical ward, they will have a lot of knowledge about what to do in specific surgeries and prescriptions that need to be tailored. So specifically for this examination, you must take into account what all different members of the MDT are telling you, and you're not going to brush someone off because they're the pharmacist and the consultant has said something. You need to show that you are taking into account what information you've been given. So just straight away going ahead and prescribing this when the pharmacist has clearly told you that there's a risk of a serious hemorrhage is straight away the wrong thing to do. Okay, so inform your consultant that the warfarin prescription is against the hospital protocol. Now, this is important because the consultant is the one that's asked you to do this. So the most sensible and effective way of resolving this is to just directly go up to them and say that this is the information that you've been given. Once you've done this, you want to then ask your consultant, well, do you want me to follow this protocol? And the reason being is because consultants obviously have got very specialist knowledge, and some different consultants like to do different things depending on their patient, that patient type, and their background and their comorbidities. So sometimes they can deviate from the protocols in the hospital, but this is because they take responsibility for that, and they are aware of the specific case. So in some situations, consultants don't follow the hospital protocol, but obviously you as a junior doctor are not going to take responsibility for these prescriptions. It is the consultant that has requested this medication to be done. So you need to then ask them, do you actually want me to follow this protocol, or are you aware that in this situation this patient can have high dose and actually they need a higher dose, maybe because of their weight or their personal circumstances, whatever, that's irrelevant. Okay, so option D, obviously this is the one that, as I'm saying, some options are clearly wrong, and in the time pressure of the exam, you just quickly get rid of these options. So it's not up to the patient to make this decision. You are the clinician, and you cannot confuse them in this manner. Okay, now option E, so you're not going to do anything drastic. You're not going to straight away change the dose of warfarin to follow the hospital protocol, because as I explained, the consultant did say that they wanted a high dose one. So because they've said that to you, you need to go back to them and ask them, actually, what do you want me to do? Because it is the overlying responsibility lies with them. And if you deviate away from the management plan, ultimately, if something goes wrong, you will be responsible for this. Now, option F. So asking the pharmacist to contact your consultant to discuss it with him directly. So as I did say, sometimes you might see that there are actually 4 options which are quite good, but you need to pick 3. Now, in this situation, option F is it's not completely wrong. It's not a wrong thing to do. And in real life, maybe you might do that if you're very busy, but actually the pharmacist has come to you highlighting this issue, and you being part of the clinical team of doctors, it's now your responsibility to escalate it up to the consultant. It's not the job of the pharmacist to now go up to the consultant and tell them again. They've already done their part, and it's your role as a junior doctor to now escalate this and manage this appropriately. So just in general, a word of advice for the professional dilemmas: if there is a question that tells you any member of staff has come and told you something about somebody else, or an issue that involves another colleague, it's never really, obviously you read the question, but it's never really sensible to tell them, oh, can you go and tell them, or can you directly speak to them when they've told you something, especially if it's about a clinical matter. If it's about something personal, it's a bit different, but if it's clinically, the pharmacist is separate from the doctor's line of escalation, so this is your job. Okay, so moving on from that one. Now, option G, ask a different senior colleague for advice on how to proceed. Okay, so again, just general rules or guidance for the examination. In general, it's always a good idea to ask for advice, and in general, that is a high-ranking option if you're not sure about what to do. But this is not always the case, especially if the clinical scenario is quite obvious on what you need to do. It's rarely sensible to ask for advice if it's clear on if the question stem is telling you that you know what to do. If the question stem says you are not sure what to do, or you need more information, yes, perhaps you can ask for advice. But in this setting, there's no need for you to now involve another senior colleague and ask them what to do, because ultimately this is going to add some further confusion to the matter, and your consultant might feel a bit undermined as well if they find out that you're asking somebody else, and the consultant has got the overlying responsibility for this prescription, and they have made this decision, so you need to go back and speak to them. Okay, now lastly, a really good response is to ask your consultant if there is a clinical reason behind starting the warfarin at that particular dose. Now, the reason being is because this will generate a clear, open discussion, and it will mean that you will also find out about why this dose is needed, and it's a good learning point for you, so that in the future, if this happens again, you perhaps could let the pharmacist know, or if the consultant has made a mistake, this can be easily rectified in the future. Okay, so as you can see, the best options here are B, D, and B, C, and H. And that's because when you then read them together, you're going to tell the consultant this is against the hospital protocol. You ask him, do you want to follow this protocol? And then you ask them, actually, is there a reason for this? And this kind of nicely closes the scenario, and it means that you can adequately manage it. So you can see how you're not picking any rash options like change the dose, keep the dose the same. This question is more about triangulating, gathering information, and staying within your remit as a junior doctor. Okay, so just to go a little bit on a bit of theory about that, just to finish that off. So whenever you are doing your own prescription, you must make sure that you have adequate knowledge of your patient's health, and you must be satisfied that you are serving the patient's need, and it's obviously the appropriate prescription. So, any prescriptions that you are signing off on the drug chart, or you're giving as a on the discharge summary, you need to obviously make sure that you've checked the allergies, you've checked their past medical history, and the medications that they're on. So in terms of what you can do as junior doctors, so you are able to prescribe for inpatients, and you can do the discharge summaries as well. Common questions that come up in the professional dilemma is your friend or your colleague on the ward has asked you to just prescribe them something like a painkiller for their back pain, or your neighbor has asked you for some antibiotics, or a family member. These are all very common scenarios that you will see coming up again. And in general, as a guide, as per the GMC guidance, you must always avoid prescribing for yourself or with anyone with whom you have a close relationship. Okay, now, obvious reasons for this is because firstly, you're not their regular doctor, so you don't know about their background and what medications they need. If it's somebody with whom you have a personal relationship with, it creates blurring of the boundaries, and you may not be able to make it may impact your decision-making process. So in general, this is something that you avoid doing, and optimum responses will say to suggest your colleague to see their GP, advise your colleague to speak to their clinical supervisor, or explain to your colleague that you're unable to do so, or assist your neighbor in contacting the emergency services or whatever. It's just about not you doing it yourself. Now, the only situation where you can give medications to people who are not registered under your care would be like for life-saving treatment, like, somebody you see has got meningococcal sepsis, or, and you give some antibiotics, or you administer like adrenaline for anaphylaxis if you're waiting for an ambulance, things like that. So obviously life-threatening. But for example, giving like antibiotics for somebody who you think has got a chest infection this doesn't count, or neither does like strong painkillers for somebody who's in pain. So obviously you need to read the specifics of the scenario, but in general, you need to avoid this. If you do choose to give somebody emergency medication and they're not, you're not in the hospital or in the GP setting, you should just clearly document what you've done, and you need to write to their GP to just explain this so that it's on their record. And as I said, you will, as we've seen, you may encounter scenarios where you're not sure about the drug dose, and there are conflicting opinions. But usually, the best thing to do is to just keep the dose at the safest, on the safest one, rather than making any drastic actions whilst you triangulate and gather further information. Okay, so guys, I hope that was helpful. That was just a quick snippet of one of the questions from the professional dilemma paper. We go through hundreds of questions during our course, and we cover a lot more technique and application of the GMC guidelines. So we will be doing a 2-day intensive course coming up in the summer, and we will be doing regular weekly sessions as well. So if you are interested, please do visit our website for further information, and I hope to see you guys at the next video. Bye.